Hi everyone, welcome back to Re the Explorer, life and learning hub where we explore science and health in ways that help you live smarter, stronger and healthier. Today, we're talking about what happens after you're diagnosed with type 2 diabetes and how the right changes in your lifestyle, diet and medication can make a real difference. Let's dive in. 1. Why lifestyle changes matter. When it comes to type 2 diabetes, your daily habits can be powerful medicine. The very first steps in treatment usually focus on lifestyle changes. Because what you eat, how active you are, and how you care for your body directly affect your blood sugar. Making these changes early can not only control high blood sugar, but sometimes even delay or reverse the disease. Here's where to start. Eat a balanced, healthy diet, get regular exercise, work towards a healthy weight, and if you smoke, find support to quit. Smoking increases your risk of complications. It's also important to keep track of your blood sugar, cholesterol, and blood pressure, because all three play a role in preventing long-term damage to your heart, eyes, kidneys, and nerves. 2. Eating for a healthier blood. Sugar food is not your enemy, it's your ally. What matters most is how you balance your meals. Focus on foods that help keep your glucose steady, fresh fruits and vegetables, whole grains, like oats, brown rice, or quinoa, lean proteins such as fish, chicken, or beans, and healthy fats like olive oil, avocados, and nuts. Try to eat meals and snacks at regular times each day. This helps your body predict and manage sugar levels. Carbohydrates, or carbs, are your main energy source, but they raise blood sugar the fastest. So instead of cutting them out completely, learn how to choose the right types and portion sizes. Ask your healthcare provider or a dietitian for guidance on the right balance of carbohydrates, protein, and fat for you. And of course, limit high sugar foods and sweetened drinks. These can spike your glucose levels quickly. Here are some very specific tips on eating well with type 2 diabetes. What to eat and how to think about food, as recommended by Diabetes UK. When you have type 2 diabetes, food isn't off limits, far from it. The smart approach is to eat in a way that supports your blood sugar, energy, and health. Many UK programs emphasize this kind of balanced, flexible eating. Here's what that means in practice. Focus your meals around whole foods, lots of vegetables, fresh fruit, whole grains, beans or lentils, lean proteins like fish, chicken, tofu, eggs, and healthy fats, olive oil, avocado, nuts. Aim to eat meals and snacks at consistent times each day. Regular timing helps your body manage blood sugar. When it comes to carbs, they are your main energy source, but choose the right ones. Whole grain breads and cereals, brown rice or oats are better than refined white versions. Reduce high sugar and highly processed snacks. For example, in the UK, you'll often see advice to swap sugary drinks or crisps for fruit and unsalted nuts. Portion control matters. Even healthy foods eaten in large amounts can push your blood sugar up or your weight up. A helpful practical pattern: fill half your plate with non-starchy vegetables, a quarter with lean protein, and a quarter with whole grain or slow-carb starchy food. If your goal is weight loss, which for many with type 2 helps improve insulin sensitivity, even losing 5 to 7% of your body weight can make a big difference. 3. Moving more. Exercise as a medicine. Even small amounts of daily movement make a big difference. Regular physical activity helps your body use insulin more effectively, which lowers blood sugar naturally. Try starting with 30 minutes a day. Brisk walking, cycling, dancing, or swimming are great options. You don't need to do it all at once. Even short 10-minute walks after meals help control glucose. Always talk to your healthcare provider before beginning a new exercise routine, especially if you take insulin or have heart problems, to make sure your plan is safe. Here are the specific recommendations by Diabetes UK regarding exercising with type 2 diabetes and why it's so important. Exercise isn't just nice. It's a powerful tool for diabetes management. When your muscles move, they burn glucose and respond better to insulin. Here's how to make exercise part of your plan. Aim for at least 150 minutes per week of moderate intensity activity, like brisk walking, cycling, or swimming. Add resistance training, weights or body weight exercises, 2 to 3 times a week to build muscle, which helps your metabolism and insulin use. Don't wait for a big block of time. Even shorter walks after meals help. Sitting less also matters. Before you begin, especially if you use insulin or other medications, check with your healthcare provider to make sure your plan is safe. Monitor your blood sugar around exercise. If it's low before you start, for example, under about 100 milligrams per deciliter or roughly 5.6 millimoles per liter, have a small healthy snack. Stay hydrated, take time to warm up and cool down, and carry a quick carbohydrate source, like a piece of fruit or glucose tablet, in case your blood sugar drops too much during activity. 4. The role of weight management. Being overweight, especially if you carry extra fat around your belly, increases insulin resistance. This type of fat, called visceral fat, surrounds internal organs and can interfere with hormone balance. The good news is that losing just 5 to 7% of your body weight can improve blood sugar dramatically. For example, if you weigh 80 kilograms, losing about 4 to 6 kilograms can already make a difference. It's not about perfection. It's about progress. Every small step counts. 5. When lifestyle isn't enough, here are medication options. Sometimes, even after doing everything right, lifestyle changes alone aren't enough. That's when your doctor may recommend oral or injectable diabetes medications to help control blood sugar. Here are the main types and what they do. Metformin reduces the amount of sugar your liver releases and helps your muscles respond better to insulin. Sulfonylureas help the pancreas release more insulin. Thiazolidinediones make your fat and muscle cells more sensitive to insulin and reduce liver sugar production. Alpha-glucosidase inhibitors slow the digestion of carbohydrates in your intestines, so your blood sugar doesn't spike after meals. DPP-4 inhibitors keep helpful gut hormones active longer, helping your pancreas release more insulin when you eat. GLP-1 receptor agonists help the pancreas release insulin, slow digestion, and often promote weight loss. SGLT2 inhibitors help your kidneys remove extra sugar through your urine. If blood sugar remains high despite other treatments, your doctor may recommend insulin injections. Insulin replaces what your body can't make or can't use effectively. It's injected just under the skin, and your healthcare provider will train you on how to do it safely and correctly. 6. Monitoring your blood. Sugar keeping track of your numbers helps you see how your body responds to food, exercise, and medication. Most people with diabetes use a blood glucose meter, a small device that measures your sugar level from a tiny drop of blood. You'll use a lancet to prick your finger, place a drop on a test strip, and let the meter read it. Your healthcare team will tell you how often to check and what your target range should be. For most adults, blood glucose should be around 70 to 130 milligrams per deciliter, about 4 to 7 millimoles per liter, before meals, and below 180 milligrams per deciliter, or 10 millimoles per liter, about 2 hours after eating. If you're using insulin, frequent checks are especially important. 7. Adjusting daily life. Around diabetes based on your blood sugar readings, you may need to adjust your meals, exercise, or medication, always following your healthcare provider's advice. You'll also have follow-up visits every few months for A1C tests, to check long-term blood sugar control, cholesterol and blood pressure measurements, and kidney and eye exams to catch early signs of complications. This ongoing care helps prevent problems like heart disease, nerve damage, and vision loss. 8. Living well with diabetes. Managing type 2 diabetes isn't about giving up. It's about taking charge. When you combine healthy eating, consistent activity, and regular medical care, you can keep your blood sugar in control and live a vibrant, healthy life. Remember, stay informed, keep moving, eat smart, follow your treatment plan, and celebrate small victories. They all count toward better health. Thanks for watching Re the Explorer Life and Learning Hub. If this video helped you understand type 2 diabetes better, please like, share, and subscribe for more health education that empowers you. And remember, diabetes doesn't define you. With knowledge, consistency, and support, you can manage it and live your best life. Stay healthy, stay curious, and see you next time. Disclaimer: this video is for entertainment purposes and not health advice. Please consult your health provider for your health issues. Thanks.